A very good morning, everyone. So today I'll be taking a discussion on assessment of or the investigation of salivary gland diseases. So coming to the classification of the assessment of salivary gland dysfunction, or the diagnostic modalities are: first is the chairside investigation. We have to assess the flow rate or the flow rate of the saliva, that is stimulated or unstimulated salivary flow. Then plain film radiographs, salography, ultrasonography, computer tomography, radioisotope imaging or scintigraphy, magnetic resonance imaging, saloendoscopy, salochemistry, fine needle aspiration cytology, and salivary gland biopsy. Now, xylography is a simple investigative procedure which is commonly used for the investigation of salivary gland disorder, and it can be defined as a radiographic demonstration of major salivary glands by introducing a radiographic contrast medium into the ductal system. So as in this picture, we can see a contrast medium is injected to the parotid salivary gland duct. So coming to the indications of xylography, it is mainly to determine the presence or position of calculi or other blockages, to assess the extent of ductal and glandular destruction secondary to an obstruction, to determine the extent of glandular breakdown, and as a crude assessment of function in cases of dry mouth, to determine the location, size, nature, and origin of a swelling or a mass in the salivary gland. So, what are the contraindications of using xylography technique? That is, in xylography, will come in the next slides. That is, a contrast medium is injected to the salivary gland duct. So, the main contraindication of using the xylography technique is allergy to compounds containing iodine, acute inflammation or infection, when the calculus is close to the duct opening. So the reason behind this is that as the injection of the contrast medium may push the calculus back down the main duct and it might be inaccessible. The contrast medium mainly used are the oil-based medium, mainly the lipidol, pantopaque. The advantage of using an oil-based medium is that since it has got a high viscosity, it is slow secretion rate, and it has got a good contrast. Whereas the disadvantage is that again, due to the high viscosity during injection, calculi may be pushed in, and the extravasated contrast may also cause foreign body reaction. Now coming to water-based media, mainly ionic and non-ionic. Ionic example is hypake, urographene, Conray, and non-ionic example is neopam and ultravest. The advantage of using a water-based medium is it is easily introduced and removed from the gland, and no foreign body reaction is found as in oil-based contrast medium. And disadvantage is that less radiopaque and rapid excretion. So what are the steps in xylographic procedures? That there are three phases. That is pre-operative phase, that is the first phase. In pre-operative phase, the radiographs are taken before the administration of contrast medium. So this is to know the presence of radiographic obstruction, to assess the position of shadow caused by the normal anatomic structure, and to assess the exposure factors. So for these three reasons, we are taking a pre-operative radiograph. So that is the first phase in xylographic technique. Second phase is a filling phase. So in filling phase, the duct orifice is probed, dilated, and cannulated. And the contrast medium, we have told about the contrast medium. So this contrast medium is introduced through the duct orifice, and two radiographs are taken at right angles. The third phase is the emptying phase. In this, the cannula is removed and the patient is asked to rinse. And the radiographs are taken at 1 and 5 minutes. So what are the allographic techniques used? So before we have done with 3 phases, that is the preoperative phase, filling phase and the emptying phase. Now moving on to the techniques, that is first one is simple injection technique. In this, the contrast medium is introduced into the duct using gentle hand pressure until the patient experiences discomfort. So the advantage of using this simple injection technique is it is very simple and inexpensive. But the main disadvantage is that the arbitrary pressure may damage the gland, and reliance on the patient response can lead to underfilling or overfilling. So we have to totally depend upon the patient response, whether the patient is having pain or not. The second technique is a hydrostatic technique. In this, the contrast medium is allowed to flow freely into the gland under the force of gravity. The advantage is simple and inexpensive, and this is less likely to cause a damage. Again, this is also based upon the patient response. So that is the main disadvantage of hydrostatic technique. The third one is a continuous infusion pressure monitoring technique. In this, the ductal pressure is monitored throughout the injection. And here the advantage is that no gland damage or no overfilling. And the disadvantage is that it is complex and time consuming. So what are the radiographs used in this technique? For parotid gland, we use panoramic radiography, lateral oblique view, rotated PA or AP view, or intraoral view of the cheek. For submandibular gland, we use panoramic radiography, lateral oblique view, 90-degree occlusal view, mandibular occlusal view, and true lateral skull with tongue depressed. So coming to the normal allographic appearances. So after taking the procedure is done, so how do you see that in the radiograph? For a parotid gland, the main duct is of even diameter 1 to 2 millimeter, and it should be filled completely and uniformly. So the normal appearance of parotid gland is tree in winter appearance. The submandibular gland, again the main duct is of even diameter, that is 3 to 4 millimeter, and we have a bush in winter appearance. So these are the pictures that is showing tree in winter appearance and of parotid gland, and bush in winter appearance of submandibular gland. So this is a tree in winter and bush in winter appearance. This is a submandibular gland, bush in winter appearance. Now coming to glandular changes, in sialadenitis or sialactasis, we can see sausage string appearance or string of bead appearance. In Sjogren's syndrome or punctate sialactasis, we can see snowstorm or branchless fruit-laden tree appearance, and tumors, mainly in benign tumors like in pleomorphic adenoma, we can see ball in hand appearance. So this is a Sjogren's syndrome ciliography of a female patient, appearance of a cherry blossom appearance. So moving on to the next investigative procedure is a salivary scintigraphy. In this, that is a radioisotope imaging that is mainly used to assess the function of salivary gland. So in this, a radioisotope scan may be performed with an IV injection of a radionuclide, and the salivary glands normally concentrate 99 m per tectate. And the main indication of scintigraphy is that dry mouth due to salivary gland diseases such as Sjogren's syndrome, and this is mainly assessed to assess the salivary gland function. So these are the main techniques for the investigative procedures that is mainly used in salivary gland disorders. So to conclude, a proper investigation is necessary for a proper diagnosis and treatment plan. So mainly we use psilography, which is the simplest technique, and which is used for the proper treatment plan of salivary gland functions. Thank you.